So yes, today we are going to discuss about the immune system, and in the last class, I remember we discussed about the immunity. You remember immunity?
Yeah.
Okay, so as I already told you, immune response basically works on the two things. Can you tell me that, Vishnu? What are the main two thing of the immune system? Immune system works on the two main thing. Remember, one
Immune and
thing.
acquired. Innate and
No,
acquired.
no, no. These are the types. These are the
Okay.
type. I'm saying immunity works on the two main thing. What is that?
Lymphoid and antibody.
No, no, no,
Lymph
no,
nodes.
no, 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 no. Specificity and memory.
Memory.
I told
Oh,
you,
wait.
isn't it? Specificity means if any particular virus like enter in your body, so it is specifically target that virus or a pathogen, right? And specifically make antibody, and it will remember for the second time. That is the principle of vaccination, right? Why we are
Yeah.
giving vaccination so that it can remain in the memory, and whenever real corona will enter, it can directly attack on that. Okay, I told you this thing. Yeah, so now if I talk about the immune system, so we have basically like two type of the lymphoid organ. So
Lymph nodes and activation.
immune system is basically making you capable to fight with the foreign agent, if I am not wrong, right? Am I right?
Oh
Immune
yeah, yeah.
system. So immune system, the main function of the immune system, you know it very well. We have to recognize the foreign agent and we have to kill them. We have to attack them, right? Right?
Hmm.
Okay. So you should know one thing. We have the memory. We have to keep memory so that whenever any pathogen enter in a second time, so we have to give very high response. You know it very well. Secondary response is very much higher, very, very much higher, right? So in the immune system, you should know we have the lymphoid organs.
Lymph nodes, yeah.
Yeah, no. Lymph nodes we will discuss, but I'm right now talking about lymphoid organ. That is a part of the lymphoid organ. So
Okay.
lymphoid organ actually, like what is that actually? So lymphoid organ are those organ where the lymphocyte are getting born. Okay, like creation. It is the
Lymphocytes.
origin. Yeah, lymphocyte. Lymphocyte are the WBC, right? And
Yeah.
it is getting matured here. It is getting matured here. So these are the organ where the origin and the maturation of lymphocyte are going to take place. Okay, so you should know one thing. What is the main function of the lymphoid organ? So you should know first is the origin, second is the maturation, like it is getting matured here. So maturation and the proliferation, like they are moving towards any particular type of organ and they are reproducing or they are like increasing their number. So proliferation
Proliferation.
of lymphocyte from one lymphocyte to two lymphocyte, two to four. So these are also going to take place. Okay, so these are the lymphoid organ. So lymphoid organ actually basically of the two type, mainly primary lymphoid organ, primary lymphoid organ,
So wait, hold on. I'm not done yet. Origin, maturation,
and is the secondary lymphoid organ.
and proliferation.
So if you have more number of lymphocyte, it means you are quite quite strong in terms of immunity. But if you don't have the lymphocyte, if you have a very less lymphocyte, then you are not considered as a like strong immune, like you are strongly guy. So strong means we should have more and more lymphocyte, that then we can say we have a strong immune system. So always remember primary lymphocyte organ are those organ where the lymphocyte undergo the maturation and the differentiation into a antigen specific lymphocyte. You have to remember primary lymphoid organ are only two, bone marrow and the thymus. This is the main one. Like bone marrow is this side. Sorry. This is the thymus. Thymus this side. See, this is the here. Here you will see the thymus. Thymus and bone marrow in the long bones like femur, tibia. All these are long bones. So inside that you will see red portion. That is a bone
Yeah.
marrow.
That's
So
where blood cells are formed. Yeah.
yeah, blood is also getting formed here. Yes, exactly. So maturation and the development into the CCC, Vishnu. Suppose if any virus entered in your body, so we have to make a random antibody or the specific antibody to kill them.
Specific. No, yeah.
Of course, specific,
Yeah.
not the random one. Okay,
Wait, yeah,
so
hold on.
that's
I'm not
why.
listening to you.
So
Hold on.
this primary lymphoid organ, so here, actually primary lymphoid organ contain the immature lymphocyte. Immature. So that's why we have to convert them mature, we have to develop them, and we have to create antigen specific, it means virus specific lymphocyte, so that it can kill the virus. Okay.
So unspecific to specific.
Yeah, so I'm just writing here. See here, see on the board. Primary lymphoid organ is the one where the immature lymphocytes undergo undergo maturation, or maturation you can also say that it's a kind of development, like it's a differentiation.
Undergo maturation and differentiation.
Yeah, into into
Specialized cells.
antigen specific, antigen specific lymphocytes. Okay, so the main example, I should say, bone marrow,
And thymus.
yeah, and the thymus. These are the main lymphoid organ, bone marrow and the thymus. Next, if I talk about, so it's the secondary lymphoid organ. Secondary lymphoid organ meaning is where the you can say the lymphocyte interact with the antigen, like the any kind of virus, or like just tell me, Vishnu. Suppose if any virus entered in your body, okay, and the lymphocyte are coming, and it is recognizing, oh my God, such type of antibodies we have to make. So right now you have only one or two type of lymphocyte, and now they are going in your body again, and they are making clones so that they can increase their number. See, if your body you have only 5 lymphocyte, and even your friend have a 5,000 lymphocyte, so who is strong?
The person who has more lymphocytes.
Yeah, more lymphocyte. So that's why we have to make a specific lymphocyte to kill them, to kill any kind of virus or any kind of pathogen. So that's why in the secondary lymphocyte help to make copies, help to
Oh,
make copies. Okay, so we can say like usually in India, I usually tell a story to guys, like suppose if
makes a
they
copy of what?
yeah, makes copies of lymphocyte if itself, so that it can kill antibody, sorry, it can kill
Virus.
antigen, yeah, virus, not antibody. Antibody is good for us. Okay, so where the lymphocytes lymphocytes interact with antigen, with the antigen, and it proliferate. I told you na, here proliferation. So it proliferate into these organ, these secondary
What
organ.
does proliferate mean?
Proliferate means they are going into these tissues or the organ. I will tell you the examples. Like we have the secondary lymphoid organ like Peyer's patches, like small intestine, like tonsils. So they are proliferating there, and they are trying to increase their number. They are making their copies. It is something like amoeba is going somewhere. It is proliferating to a specific site, and it is increasing its number. Okay, it is something like that. So they are proliferating and making what? Can we say that it's making clone, to form a clone? Vishnu, what is the meaning of clone?
To make copies of.
Yeah, and what is the meaning of like copies of what? But what is the meaning of clone? Can we say genetically and morphologically similar? If you have a two Vishnu, suppose if I have a two Vishnu,
No, not
and
similar, identical.
Yeah, identical one. Yeah, similar, identical. They are
No,
same.
similar is different. Similar means like they're close but not the same.
Okay.
You and
Uh,
I are similar, but we're not the same person. Like that. We both like
okay.
bio. We
Yeah,
both
yeah,
like
yeah.
bio.
Okay, okay. Then I got it. Okay, fine.
Identical,
In
yeah.
the clone, we have to use the two words morphologically, it means from outside, and the other word is genetically, from the
Okay.
inside.
All
Okay,
right.
so morphologically and the genetically similar it should be. So just I
Oh,
usually tell a story to students. See, there is a guy and he is basically from the India. Okay, so he is getting birth in India, so that's why it is a primary country for him. Your main country is India, and then we can say you just shifted in the US, right? So it means your origin. See, your origin and your maturation is taking place in India or US. I know you are right now in US, but still suppose right now you are in India. So it means your origin and you are going to get matured in India only, right? And then for the higher studies, you are shifting to the secondary lymphoid organ. It means which is US. So you just shifted in US, and now suppose and now in the US you are going to marry. Don't think too much, I'm just telling you are going to marry with a girl, right? So of course then after some years you will have a babies also. So it means you are increasing your number. I mean, your number means like family number, right? So same thing. So in the secondary lymphoid organ, can we say that they are making clones, they are making their, they are increasing their number?
yeah.
So it means, did you get this point? What is primary lymphoid organ, what is secondary lymphoid organ?
Yeah.
So, example, you should know like secondary lymphoid organ where the number is going to increase. There is a name spleen. There is a
Oh,
lymph nodes which you were saying. Lymph nodes, like this is a lymphatic system. So
wait.
there is a
Isn't the
lymph.
spleen where all the dead like blood cells go?
Yeah, yeah, exactly, exactly. Spleen is that organ.
How does it get rid of the cells?
Yeah, I will explain the mechanism. Just give me time. So it's a
Yeah.
spleen. It's a lymph nodes. I'm just covering that. Tonsils. You know, not like some people say we have the tonsils.
Yeah, yeah.
Tonsils,
They're not necessary.
appendix. Do you know like
Adenoids.
our appendix is not working, it's non-functional, but still it is helping increase. It is working as a secondary lymphoid organ. Like mostly lymphocyte are making their clones there. Okay,
Adenoids.
yeah. And the last is the we can say that like in the small intestine we have the Peyer's patches. So can I write there Peyer's patches of the small intestine? Peyer's patches of the small intestine. Got it now?
Yes.
Yeah, and these small intestine there is a some Peyer's patches, and these Peyer patches also help working as a secondary lymphoid organ, and they help in increasing their number. Got it?
Yeah.
Okay. So now we are going to discuss, like you know it very well, bone marrow and the thymus. It is the main organ. Thymus is is at this side, right? And with the age, thymus is actually like going to decrease with the size. Yes or no? So
Yeah.
okay, okay. So firstly, I'm taking bone marrow. So it is a primary lymphoid organ or the secondary lymphoid organ. Tell me.
Primary.
And what is the main function of primary?
To like
I told you origin
undergo
and the
undergo no,
maturation.
I
Yeah,
was gonna say it. Undergo maturation. I mean origin naturation maturation
yeah,
and
maturation.
proliferation.
So it is the main lymphoid organ. Okay, remember that. And the lymphocytes are formed here, yes or no?
Yes.
Okay,
Immature.
yeah, mature also. Yes, very good. So lymphocytes are mainly are formed here. Okay, and of course they are going to you can say, so it's a kind of they provide the micro environment for the development and the maturation of B lymphocyte. So all the lymphocyte which are getting formed, you will call it as a B lymphocyte. Okay, so B lymphocyte. So maturation and development are also taking place here. So origin, maturation, development, all these things are happening there only. Got it?
Mm-hmm.
This is the bone marrow. Now, if I talk about next one is the thymus. If I talk about the thymus, so you should know one thing. Thymus is located beneath the chest, right? So it is like this is my chest, so it is just beneath the chest, like chest
That's a
bone
gland,
near the
right?
heart. What?
It's a gland.
Thymus is a gland, yes, exactly, and it is going to be decreased with the size, and it releases a hormone which is called thymosin. Yes, you are completely
Okay.
right. Okay, so thymus, it comes under the endocrine system. We will discuss later
What does it
because
do?
it is doing the same thing for your immunity, and for it is also maintaining your calcium and phosphate level in your body.
Oh, is this a
Okay.
primary like organ?
Yeah, it's a primary lymphoid organ. Yes, yes, it is
Okay.
doing the same thing.
Oh wait.
Lymphocyte maturation, development. Have you ever heard about B lymphocyte and the T lymphocyte?
Yeah.
So T lymphocyte is done by the thymus. Okay.
Oh, and B lymphocytes in my bone marrow.
Yeah, yeah, in the bone marrow. Yes, exactly. Very good.
Wow.
So these two main are the thing which release the like lymphocyte. Okay. So it is also known as the like so thymus is located beneath the chest, and we can say that also like near the heart.
Then where is it like? Where are the white blood cells found in
White
the blood?
white blood cells are present in the plasma. Like
Oh,
you know it
they're
very well. See, in our blood. Haven't I told you about the blood? Like blood is basically 55% is plasma, 45% is the blood corpuscles, and in the blood corpuscles we have the WBC. So in our blood, normal red blood, and in our plasma, we will find the WBCs. Okay,
so
so
blood is not a liquid.
they
It's a
are
plasma.
what?
It's blood. So blood is a plasma, right?
Yeah, 1 second. Plasma is a blood. Plasma is a
Oh,
blood. Blood is divided into two main category. 55% of blood is called plasma, 45% of blood is called blood corpuscles, and blood corpuscles is divided into two main parts like RBC, WBC,
and
and
platelets.
platelets. Haven't I told you all this thing?
No.
Oh, okay, then when we will start the human physiology, then I will tell you all these. Okay.
All right.
And I can't see your face. I can see your fan. Very good fan, nice fan. I am just loving it, but I can see only your hairs. Yeah, nice hairstyle. Thank you. I will try to do the same. Okay. Yes. So, yeah, it's a thymus. Thymus is located beneath the chest and near the heart. And of course, what is it is doing? So, it is, I told you, with the age, its size is increasing or decreasing?
Increase or decreasing? Decreasing.
Decreasing. That's why it will release very less hormone, and immunity is also going to be slower. So, reducing in size. And it is doing the same thing, maturation, development. Okay, I'm just writing the arrow here so that you will get the idea, like they are doing the same things as like the bone marrow, but it should be B lymphocyte or T lymphocyte.
T.
Yeah, it is doing the same thing but of the T lymphocyte. So in your body we will have T lymphocyte or the B lymphocyte.
Both.
Yeah, both. Very good. I thought you will choose only one. Okay. Okay, so now
Okay.
we have second one is the spleen. Spleen is the primary lymphoid organ or the secondary lymphoid organ?
Second.
Uh, are you sure?
Yeah.
Okay, yes, you are right. Okay, so spleen. So firstly, what is the main function of the? Hey, what is that white on your hair?
Marker. It's a
Oh,
marker.
okay, okay. So this spleen, so it mainly contains, you should know, lymphocyte and the phagocytes. Okay, so it filter the blood. Remember, what are the main function of the spleen? See, of course, it is help in making the copies of lymphocyte. You know it very well. But what are the other function? So it is a reservoir of the RBC, reservoir. Okay, second thing is it filter the blood by trapping all the like microbes. It is very helpful in trapping all the harmful pathogen. It can trap that. Okay, spleen. So spleen
Yeah.
is very, without spleen you can't survive. There is a movie also, My Name is Khan. In that guy is getting like injured and his plane is completely damaged and he has to die. So it mainly, do you watch Indian movies or not, or only the
Mm,
USA one?
I like War and Boggy, not much else.
uh, Doggy.
Boggy
Oh, okay.
and War.
Okay, okay, so it means you don't like Indian movies like Bollywood.
I mean, I do. I just don't like movies in general.
Okay, okay, okay,
I don't have the patience.
okay. So it mainly contains lymphocyte and the phagocytes. Okay, so lymphocyte, of course, you know it very well, and phagocyte means which are doing phagocyte. Are you hearing some song?
No,
Oh, okay, but you are behaving like you are listening to some song. Are you sure?
I just
Okay,
yeah. I'm not.
because
Yeah.
I can feel that you are feeling like you are in disco divane and okay.
Oh, that's a good movie too. Good of
Okay,
the year.
yeah, yeah, yeah. Oh, did you watch that?
Yeah.
Arey wow. Okay, good, good. So phagocytes. But that movie is in, okay, so you watch it in English, right? Because
Subtitles. Yeah.
subtitles. Okay, okay, okay. So phagocytes. So do you understand Hindi or not?
Oh no.
No. Oh my
No.
God. I mean, and your parents know Hindi or not?
Yeah.
Okay, okay.
I
So
don't
they
know.
they didn't teach you about Hindi.
I. That's not my mother tongue
Okay, I
or
got
their
it.
mother tongue. So.
Okay. But I guess you know some words, right?
Mm,
Basic words.
kinda.
तुम्हारा नाम क्या है?
मेरा नाम विष्णु है. Yeah. Of course.
Okay, fine. Okay, so phagocytes. Okay, so phagocytes means like it is doing the simple phagocytosis and engulfing of something, as I already
Engulfing
told you.
bacteria cells.
Yeah, okay. And I told you spleen is also help in filtering the
Blood
blood,
cells.
because many when you are taking like when you're breathing, so time to time some germs are entering in your blood because of the alveoli, so that's
COVID.
why, so it filter the blood time to time by trapping it with the bone micro, like with the blood bone micro. So spleen is very helpful for trapping the microbes. Okay, trapping the microbes. And of course you should know it is a reservoir also, reservoir of RBCs. Reservoir. It is a reservoir of RBCs. Got it?
Hmm.
Okay, so this is about the first secondary lymphoid organ is spleen. And now if I talk about the lymph nodes, you know we have the lymphatic system completely. So lymphatic system is like in the gap we will have a such type of structure. So this is known as a lymph nodes. So lymph nodes. So these lymph nodes working as a secondary lymphoid organ, and you know it very well. These are helping in. They also filter the microbes, and they are trapping the microbes, and they are increasing their number. Okay. And the last is the malt. What is the meaning of malt? So malt meaning is mucosal, mucocell associated, mucosal associated lymphoid tissue.
Hmm.
So mucosal means like in our body, so we have the lymphoid tissue which is coating with the mucosal lining. So mucous linings are there in our major tracts, like in our digestive system, or we can say our like gut. It is better to say, like in our respiratory tract. Do you know we have the mucus here?
Yeah.
Mucus, so that it can trap the like microbes, and we in the urinogenital tract, in the digestive tract, whenever we have the mucus there, so that you will call it as a mucosal associated lymphoid tissue. So what is the, so actually it is the main one. Most of the 50% of the lymphoid, secondary lymphoid is malt. So it is increasing the number also, and it is helping trapping the microbes also. Okay,
Mhm.
so I'm just going to show you how it actually look like malt. So mucosal associated lymphoid tissue. Yes, just give me 1 second. Can you see that?
Hmm?
Yeah. So these are the mucosal associated lymphoid tissue. Just see at the right
Oh,
side. So these are the mucosal associated. So these are just trapping the microbes. Like it
yeah.
has some mucus. Okay. So in most of the part, can you just see that? Like here. Yeah.
Yeah.
So they like here we have the mucus. We also have some mucus here. We Peyer's patches. I told you, Peyer's patches of small intestine. You remember? So
Yeah.
and we have the urinogenital tract here. So we have a mucus, and they are. Can you just see? Like these are trapping the microbe. These are red, like this circular. These are the microbes.
Good or bad?
Uh,
Bad, right?
bad. They are just trapping that, so they are killing that. So time to time, it is continuously doing the same thing. Okay.
Those are lymph nodes, right?
Yeah, yeah.
Or
So
malt tissue,
the
malt tissue.
so these are the secondary lymphoid organ, and it is mainly the mucosal associated lymphoid tissue, and better to say malt. Okay, so it is malt.
Hmm.
Got it?
Yeah.
Okay. So these are the so lymph nodes. Lymph nodes are the small solid structure, and they are found in our lymphatic. I can show you. Just give me 1 second. So lymph tissue, you should know. I mean lymph nodes. We have complete lymphatic system, right, in our body, where the you will find the lymph. So lymph nodes is actually look like something like this. 1 second, just. Yeah, can you see that now?
Yeah.
So yes, lymphatic system, you can see like we have the thymus here. Can you just see?
Hmm?
We have the spleen. This is the spleen, this side. Okay.
Yeah.
So we have this one, and now I am just trying to show you.
Hmm.
Yes. Can you just see these circular type of thing?
Yeah.
So in our body, we have the complete system of a lymphatic system. Yeah, this one,
Holy.
this. Can you see this swollen structure, swollen at the middle,
Yeah, yeah.
like a circular? This is known as the lymph nodes, like this. And here, lymphocyte can grow. Just see it very carefully. At the sometime, it's a regular interval. It is getting swollen, like a peanut.
What happens if the lymph nodes are swole? Like, what if they swell?
No. It is naturally in the shape of swollen structure. It is not going to
I
get
know.
swell.
But what if it does swell?
So it means there is some infection.
Ah,
Is there is a swelling, so there must be some impaired function, or it is not working properly, or you it is getting damaged, or maybe
is that
you have got some injury
is
in
it
that
like a
side.
primary indicator?
Yeah, you can say that.
Okay.
And it will stop working. It is not going to trap the microbe, or it is not going to increase the number of lymphocyte then, because it
You
is
have them right
swelling.
under the jaw, right? Like under the jaw here, like next to the carotid pulse,
What? Lymph
the
nodes.
lymph node. Yeah, one
We
of
have
them.
so many lymph nodes, Vishnu. Can you
But
just
there's
see?
like one
Can you
like
count?
under
So can you count the swollen structure here?
millions.
Yeah. So we have so many lymph node structure.
But there's one
Okay.
under the jaw, right?
That is the tonsils.
What?
Tonsils.
This one here.
Yeah, we have the lymph nodes here and here, but we also have the tonsils here. Tonsils. Tonsillitis. Have you ever heard about that?
Yeah, swollen tonsils. Yeah.
Yeah. So tonsils also working as a second lymphoid organ, and yes, we have the lymph nodes. And
Is the one here
not
is
only there,
oh,
but also in our overall body.
okay.
Okay, so this is the lymph nodes are not present only this side, but also the, yeah, you can see. Can you just see that? Some when you are, when a person is smoking a lot and is speaking a lot, so lymph nodes is going to get swollen like this. it means it is showing the impaired function. Now it is not working. Okay, so doctor will give you some suggestion and like some medicines so that it can be relaxed and come to the normal one. So these are the normal one, and these are the swollen lymph nodes. Okay.
What body part are like are they wrapped? Is that a muscle, like a ligament or tendon?
No, 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 no. If swollen lymph nodes are there, then like here, so if they are swollen, so you like you will face some difficulty in speaking. If you are speaking a lot, some smoking person is doing a very rigorous smoking, so such type of things happen. Like lymph nodes are going to be swell. Okay. So these are the yeah, you can see that common cause of this swollen. Can you just see that? Like if you have a ear infection, if cough infection, fungus infection, strep throat, tonsillitis. Okay, so all these are the basically cause the swollen cervical lymph nodes actually. So cervical means like which is at the neck side, because I told you lymph nodes are present everywhere, most of the part, but so it has a particular name like cervical means like at the neck region. Got it now? Yes, Vishnu. So can you just see a complete lymph node structure in this body? It is
Yeah.
adenoid, like this lymph nodes. I guess you are talking about that lymph node, which is known as tonsil, but you were giving a very strange reaction. You were talking about that lymph node, na? Tonsil.
That's
This
a
is the
lymph node.
thigh, yeah. And this
Tonsil lymph node, right?
it like it is this is known as the tonsil, like a
Uh,
complete collection. Even just like this one. So all these are the lymph nodes, and like this is the spleen. This is completely showing this structure in our body.
yeah.
Okay, so I guess it is completely clear to you what is the secondary lymphoid organ and what is the primary lymphoid organ. I guess
Yeah.
yes. So now I'm going to start quickly the cancer. I told you already what happened in the cancer.
Hmm.
What happened in the cancer? You are saying,
Oh,
what happened in the cancer? So cell is getting the very strange power of multiplying again and again and again, and
yeah.
it is becoming a tumor. It can
Yes.
be like very
Malignant or
bad.
benign.
Yeah. So yeah, malignant, benign it can be. Okay, so if it is spreading from the one part to the another part, so that is the
Malignant.
malignant,
Metastasis.
and if it is remain confined to the specific part,
Benign.
benign, benign, yeah, benign, very good. Okay. So benign. So now, so transformation of the normal cell into the cancerous cell, right? Can we say that? Because normal
Yeah.
cell usually divide at a like normal state, but cancer cell they are multiplying at a very high rate, like just doing reproduction and reproduction. Okay, so we can say that
Yeah.
transformation of transformation of normal cells normal cells into cancerous cell cancerous cell by carcinogen. Carcinogen means, as I already told you, these are the cancer causing agent. Primary lymphoid, I mean, no, primary, no primary, that physical, chemical, and biological agents, right? So these are the carcinogen because they can cause cancer. So carcinogen can be of how many type? I
Uh,
told you, yeah, physical, chemical,
chemical
and
and biological.
biological. So what happens in the physical? I told you.
Oh, radiation.
Yeah, what kind of radiation?
Alpha, gamma, beta, theta.
Yeah, oh, theta. Okay, theta. UV ray, X-ray, and gamma ray.
Yeah, that.
So the etc. Okay. In the chemical, what we have to include?
Smoking.
Okay, and can we say
Carcinogen.
die? Many workers who are work in the chemical industries, right? If by chance they just engulf that, or by chance it is going inside their body, like dye industry or
You mean
chemical
gas?
industry. Chemical industry, right? Chemicals are not good for our body, right? chemical industry, or of course all those stuff like drug and the smoking, drug and
Meth.
all. So these are coming under the chemical. Now if I
Crystal.
talk about the biological, so in the biological, yes, I told
Uh,
you.
oncogenic virus.
Yeah, oncogenic. Oncogenic is also known as a tumor virus.
Oh,
Oncogenic virus, and it is also known as a tumor virus.
what an interesting name.
Yep. So you can put it your name. Oncogenic Vishnu.
Okay.
Okay, okay, just
All
kidding.
right.
Okay, so it's a physical, chemical, and the biological. Okay, and this is causing the cancer. And I told you, cancer has a cancer can show the two main properties. First is the metastasis. Metastasis means cancer can be spread from one part to another part, right? So this
Yeah.
property is called metastasis. But metastasis. एक second
Stasis. Yeah.
I was talking about the metastasis. Metastasis means it's the ability to spread from one part to, and there is a contact inhibition. Contact inhibition is very good property. See, if I get a tumor, okay, if by chance, okay, okay,
Okay.
so my tumor, it will release the interferons,
Yes.
and it will cover that area, and interferons will say, see tumor, you can't go ahead of this.
Mm.
We are just creating a circle, and
It's like a
you can
boundary.
yeah, it's a boundary, it's a restriction, you can't go out.
Yeah.
So it means it is a contact inhibition of interferons,
Yeah.
like
Quarantine
you
zone.
can't go outside. So contact, like
Quarantine
suppose
zone.
if my body is showing contact inhibition, so is it good or bad?
Bad.
Are
Oh, it's good. It's good. It's good.
it's
It's
good. It's
restricting.
good. Why? Because it is restricting the cancer cells, like
Yeah.
remain this side, you can't go ahead. But if it is a metastasis, but
Oh
suppose
shit.
if cancer is very very harmful, then he doesn't care about, he or she, I don't know cancer is male or female, cancer doesn't care about the contact inhibition.
They.
It will break the contact inhibition, and it will spread from one part to another part.
Yes.
Okay, so it means metastasis means it's the ability to spread from one part to another part by the
Yeah.
cancer cells, and contact inhibition is the property of the interferons to make a boundary. Like it's like a Lakshman Rekha. I don't know, you don't
Yeah.
know, you know Lakshman Rekha.
Yes, I do.
Oh, so like Sita ji.
You think I'm uncultured?
No, 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 no. I don't think. I just like you are not aware. I just. Okay.
I know all this stuff. I'm not.
Okay.
I'm raised a Hindu, so I know all this stuff.
Oh, okay. So there's a Lakshman Rekha, right? And Sita ji was crossing that Lakshman
Yes.
Rekha,
Yeah.
and Ravan was taking her. Okay, okay.
Story
So
time.
yes, so we have the two type of tumors. First is the benign tumor, and other is the malignant tumor. So you have to tell me, benign tumor will show metastasis or not?
No,
Okay, may I know the reason for same?
because benign they don't travel. They stay in one place.
Yeah, so benign,
It's the confined one.
yeah, it's confined to the specific site. Okay, so
I
yes,
forget what it's
it,
called.
it will not show metastasis. So this is a good property or bad property?
It's
I mean,
good.
tumors are bad, I know, but still, as compared to malignant, it is quite fine.
It's just like a good. It's like a good
Yeah,
tumor.
yeah. So suppose if it is inside my skin, so that can be considered as a good. You don't have to remove that. Like, okay, it
It's
is
a
inside
good.
my skin.
It's a good bad tumor.
Yeah, yeah, very good. Playing of words, okay. And malignant will show metastasis.
Yeah.
M metastasis. Okay, so it will show metastasis. But when I, yeah, now tell me, malignant tumor will show contact inhibition.
No.
No, contact inhibition means it is restricting the tumor, but it is not restricting actually. So contact inhibition, it will not there, but here there is a contact. So in the contact inhibition, it is done by which protein? I told you.
Interferons.
Yeah, interferons are very good proteins, okay, and it's a therapy. Interferons are also used in the therapies, okay. So see, if you have a cancer, so how can we diagnose that? So there is a CT scan. Have you ever heard about CT scan, computed tomography? There is a
Yeah.
MRI. You have to go for the
Magnetic
process.
resonance imaging.
Yeah, magnetic resonance imaging. Okay, and there is a blood test also. There is a blood test. Okay, there is a like biopsy test. Okay, histology studies.
Oh,
So they,
biopsy. You just take a piece of a tissue or like a
yeah, yeah,
organ.
yeah, and they are checking that like,
Painful.
yeah, yeah, maybe a little bit. Okay, so these are the diagnosis. So now you have to tell me like what can be the treatment of the cancer. Treatment. How can
Well,
we
you have
treat?
to reduce the growth of the tumor somehow.
Okay, if I talk about the treatment, so first is the
Oh,
surgery.
chemo,
Suppose, yeah, yeah, if we will take that. So suppose if
proton.
there is a tumor here only, here, it is not
Oh,
spreading. So we
okay.
what we can do, we can cut that, but
Yes.
it is not getting removed from the origin. So we are cutting that from the origin.
Ah, I see.
Okay, and then we are doing the like that white. What is that? Patti?
Gauze.
Yeah, okay. So surgery. So this is known as the surgery. So what we are doing in that? So
Oh
the tumor,
yeah.
the
Surgery. Yeah.
tumor cells are surgically removed. Okay,
Yes.
so that we
Removed.
can completely remove the cancerous cell. Okay, so
Yeah.
surgery it is. Now, second we have the radiotherapy. So radiotherapy means radiotherapy. Do you know radiations?
Yes.
So with the help of the radiation, we are trying to burn that. We are trying to burn, like we are completely like giving the radiation and we are killing your tumor cells. It
Hmm.
may be painful, I know, but we are killing them because burning is very good treatment. So that's why we are killing your all the tumor cell by the burning, by the radiations. Okay.
Yeah.
There is a chemotherapy. We are giving drugs. Drugs means good medicines which are very costly. Okay, so certain drug used to kill the cancerous cell, but it has a side effect, right? Your all hairs will be removed, you will become bald. Hello,
Isn't
sir.
chemotherapy like radiation?
Chemotherapy? No,
Oh,
chemotherapy means it's a drug only, like the medicines.
okay.
That's why a lot of heavy doses of medicine. That's why you will lose your hairs. Your skin will be like, it may be some side effects, some red spot on your body, or like very harmful side effect maybe, which you don't like. Maybe.
Hmm.
Got it now? And last therapy is known as a immunotherapy. Can you guess what is that immunotherapy?
Injecting immune cells to kill the thing.
Interferons. So
Oh yeah.
if your body has a lot of interferons, so it will make Lakshman Rekha everywhere. Everywhere there's a Lakshman Rekha. So that's why cancer cell
But
automatically
it.
getting reduced.
Hmm.
So if you
But
have a
but
more
but
interferons, yeah. Say.
but doesn't the interferons that's only contact inhibition? Does that reduce the cell
Yeah,
tumor?
reduce the cell, but if you have a more interferon, so it can involve in directly killing that also, same like
Oh,
from. Okay,
okay.
so this involves the use of the biological response modifier. It means
But there has to be some side effect.
if you have a more interferons, if you have a more lymphocytes, more WBC cells, so these cancer cells automatically get killed. So that's
Well,
why it is a kind of treatment in which we are activating your immune system. We are making your immune system super strong, so it can automatically killing that tumor cells. Okay,
what's the side effect?
there is no side effect. It is a good
Nah, there
method.
has to be something.
Immunotherapy because it is not natural, so you will get some little bit side effect, but actually I don't know about the immunotherapy because I haven't like gone through this immunotherapy. I will see that and I will tell you.
Which
but
has the least
but the
risk?
immunotherapy is very good option because
Yeah.
it is a kind of natural. We are just like in the coronavirus, many people are taking vitamin C tablets, zinc tablets, right? Why? Because they are trying to make their immune system stronger.
Yeah.
So we are doing the same thing in this tumor, actually the cancer.
Well, why won't it work for malignant? Because it can't keep up with the spread.
You are talking about corona.
No, no, no. We can't use immunotherapy for malignant tumors because the metastasis rate is too high.
Yeah. Exactly. Immunotherapies you can work only for the like not so harmful tumor, basically the benign one.
Okay.
Malignant tumor is
So,
very harmful, so maybe it depends person to person actually how much malignant it is. How much? It is not just the two category, na. It can be like middle category also. Like tumor is only up to that part, tumor is not getting, suppose a complete body is getting tumor,
Hmm.
then
Just die.
yeah, so it's a very very painful situation. Okay, so surgery we are automatically cutting that, radiotherapy we are using radiation and burn that, chemotherapy we are taking a high dosage of drugs, chemicals which we take and you will be bad.
That's the worst option.
Yeah. Fourth option.
That's the worst option.
Yeah, and last is the immunotherapy, in which we are activating your immune system and we are using alpha interferons. Alpha interferons, you have to say, and these are very strong in killing that. Okay, so is it clear about the cancer?
Yeah. Wait, no,
Okay,
but what are the treatments for malignant?
Me- if you are getting malignant, then very like malignant also have a stages, like at which stages you are at
Oh,
the
stage
final
one, two,
stage.
three, four.
Yeah,
Yeah.
and how much malignant it is, how much, 10% malignant, 20% malignant, so we are trying to control that. But if it is like above our control, then we usually say you have to take care of yourself and you are going to in some days. Okay, because it's very simple. If it is controllable, we are trying our best. So but there is not such treatment available, but yes, we can try like surgery, like complete body surgery, complete body therapy. So
Sometimes makes it worse though.
yeah, of course, if it is malignant, then of course it is very bad situation. But in the benign, it's not that much typical. Okay, so is it fine, Vishnu?
Yeah.
Okay, so Vishnu, can you tell me how many type of the immune response? Like in the immune system, we have the two type of lymphoid organ. Can you tell me?
Lymphoid organs.
Primary and
Secondary.
primary include two main organ. What is the name of that?
Thymus and bone marrow.
Yeah, and in the secondary,
Spleen
hmm.
and lymph nodes.
Okay, very good. And malt. What is the
Oh
full form
shit.
of malt? Mucosal
Mm,
associated lymphoid tissue, Peyer's
yeah.
patches of intestine, appendix. Okay,
Lung
and what is the not
alveoli.
lung?
Yeah.
Not lung.
Yeah.
Lymph nodes near the lung, you can say,
Oh, okay.
not
Fine.
lung. Okay,
No, because
yes,
in the picture I saw that they were like, okay.
they are showing the lymph nodes this side, near the
Mhm.
lung. Okay, okay, Vishnu. So please revise all these three chapters which I just told you. Okay, and I will ping you on WhatsApp. And okay, so we have cover in the next class we are covering that human health and the disease chapter. Okay,
Yes. Let's
okay,
go.
bye bye. Take care. See you in the next
Bye.
class.